Fistula-in-Ano surgery carries an inherent risk of severe complications, primarily because cutting through infected tracts often risks permanent damage to the anal sphincter. Ayurveda offers a specialized parasurgical procedure explicitly designed to manage these anorectal disorders, the Kshar Sutra. This protocol stems from the ancient Sushruta Samhita, but it has been rigorously standardized through decades of modern clinical research at Banaras Hindu University and is currently endorsed by apex institutes like AIMS. Clinical data shows a 98 to 99% success rate for fistulas treated with Kshar Sutra. Because it preserves the sphincter muscles entirely, the risk of postoperative incontinence drops to near zero. By mastering this specific protocol, practitioners gain a minimally invasive method to clear a root infection while fully protecting the patient's long-term quality of life. The foundation of the procedure is a standard surgical linen thread, size 20. To prepare it, the thread must receive exactly 21 distinct layers of herbal medication. Each coat must be completely dried in a sterile cabinet and UV sterilized before the next layer is applied. Coats 1 to 11 are Snuhi latex, providing the initial cutting action. Layers 12 to 18 add Apamarga Kshara, alkaline ash, to chemically debride unhealthy tissue. Finally, layers 19 to 21 mix in Haridra, an outer coat for antiseptic wound healing. This raw turmeric powder is essential. Its high concentration of anti-inflammatory compounds protects surrounding healthy tissue while the inner layers do their work. This strict 21-layer sequence ensures that the outermost layers fight infection upon insertion, the middle layers chemically dissolve the diseased tract, and the core maintains the tensile strength required to pull through the tissue. Step 1 in the operating room is mapping the infected pathway. You must carefully identify both the external opening on the skin and the internal opening within the anal canal. Looking at this cross-section, a thin probe navigates from the outside opening directly through the fistulous tract. Next, the Kshar Sutra is guided alongside, replacing the metal instrument. Finally, the two ends are tied securely, forming a continuous loop through the infected tissue. By securing this loop, you effectively convert a blind, pus-filled tunnel into a controlled track, placing the active medication in direct contact with the entire length of the diseased pathway. Once in place, the Kshar Sutra operates as a chemical ceton. Mechanically, the tension of the thread holds the tract open, which allows any trapped pus to drain continuously. This cross-section shows the chemical process. The alkaline ash produces gentle cauterization, slowly dissolving the infected tissue in front of the advancing thread. Simultaneously, the turmeric coating stimulates fresh granulation, so healthy pink tissue instantly fills the space left behind. We track this steady pace using a metric called unit cutting time, or UCT. On average, the thread will cut and heal 1 centimeter of fistulous tract every 7 to 10 days. This macro time-lapse demonstrates that steady biological pacing. The infected structure is incrementally divided, while smooth, repaired layers are deposited in its wake. A conventional scalpel excises the tract completely, creating an open wound that must heal secondarily. The chemical ceton dynamically replaces the diseased pathway with healthy tissue from the inside out, preserving the surrounding sphincter. Patients can walk out of the clinic the same day. Postoperative care requires them to take daily warm sitz baths, maintain a high-fiber diet, and crucially, they must never pull or move the thread themselves. You must educate your patients on how to monitor their discharge using a simple clinical guide like this one. The light yellow, odorless fluid on the left is a normal byproduct of tissue debridement. The dark, purulent fluid on the right indicates a secondary infection that requires immediate attention. The active medication on the thread depletes steadily over 7 days. Once the alkaline coating is exhausted, the chemical cutting action stops. We maintain the process using the railroad technique. The external knot is untied, and a fresh Kshar Sutra is secured to one end of the old thread. Pulling the old thread out drags the new medication perfectly into place without requiring a surgical probe. Maintaining this strict weekly replacement cycle ensures continuous chemical pressure. Without it, the tract will fail to cut and heal at the correct unit cutting time. For a standard fistula, you will repeat this weekly cycle for approximately 3 to 4 weeks. With each visit, the tract will measure demonstrably shorter. Eventually, the remaining tract becomes entirely superficial, and the final loop of thread simply falls out on its own. This comparison chart shows the end point. When that final thread drops, the interior wound is already 89% healed. The small surface dimple that remains typically closes entirely within 7 to 10 days. By methodically applying the 21 layers of the Kshar Sutra, you eradicate the internal source of the infection, preserve the patient's continence, and deliver a permanent structural cure.